Welcome to the deep dive. We love taking something that seems pretty simple on the surface, maybe an everyday problem, and then really digging into the surprising complexity, the fascinating science hidden just underneath. And today we're doing exactly that. We're tackling a topic that sounds, well, maybe deceptively straightforward: piglet diarrhea. But that common phrase, it actually hides this persistent, economically really significant and scientifically challenging battle that's happening on farms all over the world. We're diving deep into porcine rotavirus. Think of it as an invisible enemy, one that throws up some truly unique and honestly surprising hurdles for pig producers. So our mission here is to pull back the curtain on these hidden threats, the surprising scientific puzzles in controlling this virus that's just everywhere. And we're drawing directly from the sources you've shared with us. Let's get into it.
Yeah, absolutely. Porcine rotavirus is, well, it's genuinely one of the most significant and widespread causes of acute viral gut problems, gastroenteritis, in young pigs globally. It was formally identified in pigs back in the mid-1970s. That was shortly after scientists found it in humans and calves, actually. And since then, it's become recognized as what we call an endemic pathogen.
Endemic, meaning it's just always around.
Exactly. It's continuously present, circulating within breeding herds. You find it in virtually all commercial pig production systems worldwide. Its persistence, its ubiquity makes it this constant management challenge. Now, it's different from those explosive, high mortality outbreaks you might think of, like PED, porcine epidemic diarrhea. Rotavirus typically follows an enzootic pattern, so instead of a big sudden flare-up in a herd that's never seen it before, it's more like it's always simmering in the background.
Right.
It mainly causes disease in those very young neonatal piglets and also the ones recently weaned. That's when their immunity from their mother naturally starts to fade. And this endemic nature, it means control isn't a one-off thing. It requires a sustained, ongoing effort. And the prevalence is, well, it's incredibly high. Nearly 100% of adult pigs show signs in their blood serological evidence that they've been exposed.
Wow, nearly 100%.
Yep. It just highlights that rotavirus is pretty much an inevitable presence in modern pig farming.
So if I'm hearing you right, it's not just everywhere, it's always there. It's less about if it's on a farm and more about when and how it's going to hit the piglets.
Yeah.
Given it's so widespread, are we just talking about one type of rotavirus? Or is it more complicated?
Oh, it's definitely more complicated. Porcine rotaviruses, they're classified into different species. We used to call them groups. We know of at least 5 that infect pigs. There's rotavirus A, B, C, E, and H.
5 different ones. Okay.
Yeah. And among those, RVA, RVB, and RVC are really the ones that cause the most trouble, clinically and epidemiologically speaking, for pigs. RVA, or rotavirus A, that's historically been the most studied. It was considered the most common, kind of the main cause of diarrhea in newborn piglets. But, with better diagnostic tools now, molecular methods, we're seeing a more nuanced picture. For instance, rotavirus C, RVC, is increasingly being flagged as a major pathogen, especially in those very young neonatal piglets. In some situations, it's actually found more often than RVA in piglets under a week old.
Really? More than A?
Yeah. And then there's RVB, rotavirus B. That one's detected frequently too, often in pigs after weaning, and even sometimes in older fattening pigs. So it seems like different species might prefer different age groups, you could say. But here's where it gets really interesting, and it's a critical challenge for control.
Okay.
There is absolutely no cross-protective immunity between these different rotavirus species.
Wait, none. So immunity to A doesn't help at all against B or C?
Exactly. Zero cross-protection. If a pig develops immunity to rotavirus A, it's still completely susceptible to rotavirus B or C. And this lack of broad immunity is, frankly, a primary reason why we keep seeing clinical disease, even in herds that are, properly vaccinated against RVA.
Wow. That makes control sound incredibly difficult then. It's like you're fighting multiple different enemies at once, and your shield only works against one of them.
That's a really good analogy, yeah.
So you mentioned that mortality isn't always super high in uncomplicated cases. If that's true, where does the actual economic hit come from? Where's the hidden drain for the industry?
That's a great question. You're right, the economic burden is substantial, but it's primarily driven by production losses, not necessarily high death rates if it's just rotavirus on its own. The disease typically has high morbidity, meaning lots of piglets get sick, but relatively low mortality, maybe, say, 7 to 20% if they get good supportive care. Dehydration is usually the cause of death when it does happen.
So it's the survivors that cost money.
In a way, yes. The real losses pile up from reduced growth rates. The pigs just don't grow as well. They have poor feed conversion efficiency, meaning they eat food, but don't convert it into weight efficiently.
Right.
And that ultimately leads to increased days to market. They take longer to reach their target weight. And that stunted growth, especially during those crucial early weeks, can have lasting effects on their performance throughout their life.
Okay, so long-term impacts too.
Definitely. And then you have the direct costs, the extra labor needed for supportive care, nursing sick piglets, plus the cost of treatments like electrolytes for rehydration and often antibiotics for secondary bacterial infections that jump in.
Are there actual numbers on this? Like, how much does it cost?
Well, pinning down the cost just for rotavirus is tricky, but one estimate from Australia looked at piglet diarrhea from all causes. They pegged the annual cost at over 7 million Australian dollars, which is roughly, 4.8 million US dollars. And rotavirus is known to be a major consistent contributor to that figure. And here's where it can get really devastating economically, the synergistic effect.
Synergistic, you mean when it teams up with other bugs?
Exactly. When rotavirus hits alongside other gut pathogens, especially bacterial like E. coli, specifically E-tech strains or Clostridium perfringens, that combination can dramatically increase mortality. It turns what might have been a manageable, though costly viral issue into a much more significant cause of death and economic loss.
Okay, that's a serious impact. Even without the high death rates from the virus alone, it really is this sort of constant hidden drain. Can you tell us a bit more about the virus particle itself? What's it like and what makes it so darn tough to eliminate once it's on a farm?
Sure. So picture the rotavirus particle. It's like this tiny, incredibly resilient, non-sticky ball. It's about 100 nanometers across, so you need a powerful electron microscope to even see it. What's really distinctive is its structure. It has this triple-layered protein shell, or capsid. Under the microscope, it looks kind of like a wheel.
Ah, hence the name rota.
Precisely. Rota is Latin for wheel. And that robust, multi-layered structure, that's the key to its toughness. It allows the virus to resist drying out desiccation, survive pretty big temperature swings, and stand up to many common disinfectants that would kill other viruses.
So it can just hang around in the environment?
For months, potentially. Especially in fecal matter. That makes cleaning and disinfection a real challenge on farms. And inside that tough shell, its genetic material, its genome, isn't just one long piece. It's made up of 11 separate segments of double-stranded RNA.
11 pieces. Why is that important?
Well, this segmented genome is absolutely fundamental to its evolutionary strategy. It allows for something called genetic reassortment.
Reassortment? Like shuffling genes?
Exactly like shuffling genes. Imagine a single pig gut cell gets infected by 2 different strains of rotavirus at the same time. When new virus particles are being assembled inside that cell, they can pick up a mix of genome segments from both parent viruses. This gene shuffling means new, novel genotypes can emerge really rapidly. It's constantly creating new variations, which makes it a moving target for vaccines and immunity.
That's clever in a problematic way.
It is. And the proteins on the very outer layer of that wheel, we call them VP7 and VP4, they're particularly important. They're the main targets for the pig's immune system, the bits that trigger neutralizing antibodies. They're also how we classify different strains using that GNP system you sometimes hear about. And the diversity in pigs is huge. For RVA alone, there is something like 12 known G genotypes and 16 P genotypes.
Wow.
And here's another fascinating, slightly concerning point. Pigs are often considered significant mixing vessels for rotavirus evolution.
Mixing vessels, what does that mean?
It means we have solid genetic evidence showing that pig rotaviruses sometimes contain gene segments that are closely related to human rotaviruses. This indicates gene flow between species. It suggests that viruses can jump, or at least exchange genetic material, between pigs and humans.
So new human strains could potentially come from pigs.
That's the implication, yes. It raises potential public health concerns, suggesting that novel human rotavirus strains could emerge from a swine reservoir. It really highlights the interconnectedness of animal and human health, the whole One Health concept.
That mixing vessel idea really drives home how interconnected everything is.
Yeah.
Okay, so we understand the virus, its impact, its clever tricks. Let's get down to the pig itself. How does this virus actually cause the diarrhea and the disease inside the pig's gut? What's happening on that battleground?
Right, so the main route of infection is fecal-oral. A susceptible piglet swallows the virus particles. Once they get into the small intestine, the virus has a very specific target: the mature, differentiated villus enterocytes.
Okay, those are the cells lining the gut.
Exactly. They're the specialized absorptive cells that sit on the surface of these tiny finger-like projections called villi. These villi dramatically increase the surface area for absorbing nutrients from milk or feed. The hallmark lesion, the classic damage caused by rotavirus, is villus atrophy.
Atrophy meaning they shrink or get damaged.
Yes, the villi become shorter, blunted, sometimes they even fuse together. This happens mainly in the jejunum and ileum sections of the small intestine. Essentially, the virus infects and destroys these mature absorptive cells. They then get replaced by immature cells that migrate up from the base of the villi, but these new cells just don't have the full digestive or absorptive capacity yet.
So the gut can't absorb nutrients properly.
Precisely. Now, while this damage is significant, it's generally considered milder than the devastation caused by some other viruses, like the enteric coronavirus's TGEV, for example. We sometimes measure it using the villus height to crypt depth ratio. A healthy piglet might be around 7:1. Rotavirus might reduce it to, say, 5:1. But a really bad TGEV infection could flatten it almost completely, down to 1:1.
Okay, so it's damaging, but maybe not total destruction like some others.
Generally, yes, and the gut lining typically recovers. Those villi regrow, usually within about 7 to 10 days, assuming no major complications. Now, the diarrhea itself, it's actually caused by a few different mechanisms working together.
Okay, it's not just one thing.
No, it's multifactorial. The primary mechanism is what we call malabsorptive diarrhea, because you've lost that absorptive surface area, and there's a huge drop in crucial digestive enzymes on the gut lining, especially lactase.
The enzyme that digests milk sugar.
Exactly. So undigested lactose builds up in the gut. This creates a strong osmotic gradient, basically. It sucks water from the piglet's body into the intestines, and that results in that profuse, watery diarrhea. But there's also a secretory component. The virus produces a non-structural protein called NSP4, which acts like a viral toxin, an enterotoxin. NSP4 actually stimulates the gut cells to actively secrete chloride ions into the lumen, and water passively follows the salt, adding even more fluid to the diarrhea.
Wow, so it's both not absorbing and actively secreting fluid.
Correct. And to make matters worse, NSP4 can also stimulate the gut's own nervous system, the enteric nervous system, or the NS. This stimulation can increase intestinal motility, basically making things move through faster, and enhance those secretory processes, further contributing to the fluid loss and diarrhea.
There's a really complex assault on the gut system. Is there a particular age group that gets hit hardest by rotavirus?
Yes, absolutely. There's a strong inverse correlation with age. Generally, the younger the piglet, the more vulnerable they are. Neonatal piglets, so less than a week old, are highly susceptible, especially if they don't get enough protective antibodies from their mom's colostrum, that first milk. And RVC, remember rotavirus C, that's particularly common in this very young group.
Okay, the very newborns.
Then you have the peak incidence, what farmers often call milk scours, or maybe 3-week scours. This usually happens in suckling piglets, somewhere between 1 and 3 weeks of age. This is often seen as a critical window of susceptibility. Why? Because the passive immunity they got from colostrum is naturally waning.
Right, it doesn't last forever.
Exactly, and the protection they're still getting from milk is getting diluted as they start nibbling on creep feed and drinking water. So protection drops, exposure might increase perfect storm.
Makes sense.
And then weaned pigs are another high-risk group. They face the abrupt loss of all maternal antibodies from milk, combined with all the stresses of weaning new diet, mixing with new pigs, new environment. That often leads to a spike in post-weaning diarrhea, and rotavirus is very frequently involved there too.
Okay, so multiple vulnerable periods. Given all that, if you're a producer or a vet, what are the key signs you should be looking for if you suspect rotavirus is the culprit on a farm?
The absolute cardinal sign is that profuse, watery diarrhea. The color can vary white, yellow, sometimes gray. In nursing piglets, a telltale sign is often seeing undigested milk curds in the feces. Affected piglets usually become quite lethargic. They look gaunt, thin, and obviously dehydrated. Vomiting can happen, but it tends to be occasional and relatively mild, usually less prominent than you'd see with a coronavirus infection like PED or TGE. And as we discussed, you'll typically see high morbidity, a lot of piglets in the group getting sick, often over 80%. But in uncomplicated cases, just rotavirus alone, the mortality is relatively low, maybe 7 to 20%. When deaths occur, it's almost always due to severe dehydration and electrolyte imbalance. And this is crucial to reemphasize the critical role of co-infections.
Right, the team-up effect again.
Exactly. That gut damage from rotavirus basically rolls out the welcome mat for secondary bacterial invaders,
Yeah.
especially certain strains of E. coli and Clostridium perfringens. When those bacteria get involved, the severity of the disease and the mortality rate can increase dramatically. That combination is what often turns a manageable problem into a really significant, costly outbreak.
So what does this all mean then? Because those symptoms, watery diarrhea, dehydration, they sound like they could be caused by lots of things. How do you actually tell it apart from other common causes of scours out in the field? How do you diagnose it?
You've hit the nail on the head. Because the clinical signs are so nonspecific and overlap with many other gut diseases, a definitive diagnosis absolutely requires laboratory confirmation. You just can't reliably diagnose rotavirus based on looking at the pigs alone.
Okay, so lab tests are essential. What are the main things you need to rule out?
Well, key differential diagnoses would include, first, the coronaviral enteritis, like TGEV, PEDV, or PD-COV. They also cause watery diarrhea and villus atrophy, but typically, especially in naive herds with newborns, they cause much more severe disease, often more vomiting, and drastically higher mortality, sometimes approaching 100% in those young piglets. Then there's enteric colipocillosis, caused by E. coli. That's bacterial, of course. A useful, though not perfect, field clue is sometimes the pH of the stour. E-tech often produces alkaline diarrhea, turns litmus paper blue, whereas viral scours like rotavirus tend to be acidic, turning litmus paper red.
Interesting little field test.
Yeah, can be helpful sometimes. Then you have clostridial enteritis, especially Clostridium perfringens type C. That causes a very severe, often bloody, necrohemorrhagic enteritis and is frequently fatal. And finally, coccidiosis, caused by the parasite Cystoisospora suis, typically affects piglets a bit older, maybe 5 to 15 days old, and the diarrhea is often more pasty to watery, yellowish, or grayish.
Okay, quite a list to differentiate.
Yeah.
So what about the lab tests themselves? What kind of samples do you need?
For lab diagnosis, it's really important to collect samples from acutely affected piglets, those showing clear signs who haven't been treated with antibiotics yet. And ideally, you want samples within the first 24 hours of the diarrhea starting. Fecal swabs or sections of the small intestine are typical. The gold standard diagnostic method nowadays is PCR specifically, real-time reverse transcription PCR or RRT-PCR.
Why PCR?
Because it's incredibly sensitive, highly specific, and you can often use multiplex PCR assays. That means a single test can simultaneously detect and differentiate between RVA, RVB, and RVC, and even other common diarrhea-causing viruses, all from one sample. It gives you a really comprehensive picture.
That sounds very useful. Are there other tests?
Yes. Antigen detection methods like ELISA enzyme-linked immunosorbent assay can be used for rapid screening, especially for RVA, which is what most commercial kits target. Immunohistochemistry, or IHC, is also valuable. That involves staining tissue sections, usually from the intestine, to visualize the viral antigen directly within the damaged gut cells. This is great because it confirms the virus is actually in the damaged tissue, linking the pathogen to the pathology. And of course, histopathology, looking at stained tissue sections under a microscope, is crucial for assessing the degree of that characteristic villus atrophy we talked about.
What about blood tests? Checking for antibodies.
Serology, checking for antibodies in the blood, is generally not useful for diagnosing an acute outbreak of rotavirus diarrhea.
Why not?
Because the virus is so endemic, remember. Most adult pigs, and even many younger pigs, will already have antibodies from previous exposure or maternal immunity. So, finding antibodies doesn't tell you if the virus is causing the current problem. PCR and antigen detection in feces or tissues are much better for acute diagnosis.
Got it. So once you've confirmed it is rotavirus causing the problem, what's the immediate plan? How do you help those sick piglets get through it?
Right, so treatment. Since there's no specific antiviral drug that kills rotavirus, the focus is entirely on supportive care. The absolute #1 priority is combating dehydration. This usually means giving oral electrolyte solutions frequently. In very severe cases, some piglets might need fluids given parenterally, like intravenously or intraperitoneally, but that's more intensive. Providing thermal support is also critical. Diarrheic piglets lose body heat really quickly and can easily become hypothermic, so keeping them warm, dry, and out of drafts using heat lamps or warming mats is essential.
Makes sense, keeping them warm and hydrated. What about feeding?
Good question. For nursing piglets, you want to encourage them to keep nursing from the sow if possible to get nutrition and fluids. For weaned pigs experiencing severe diarrhea, Sometimes temporarily withdrawing solid feed for a short period, maybe 12-24 hours while providing electrolytes, can help rest the gut. Then you gradually reintroduce a highly digestible, bland diet. And importantly, given the high risk of those secondary bacterial infections.
Right. The E. coli and Clostridium.
Exactly. The judicious use of appropriate antimicrobials is often necessary, not to treat the rotavirus itself, obviously, but to control those bacterial opportunists that can make things much worse. You'd ideally base the antibiotic choice on sensitivity testing if possible.
Okay, that covers the immediate firefighting. But if this thing is always lurking, prevention must be the long game, right? Especially with all those different species and the lack of cross-protection you mentioned. How do producers even start to tackle prevention?
Prevention is absolutely key, and you're right, it's complex. The central pillar of rotavirus prevention revolves around maximizing what we call lactogenic immunity.
Lactogenic, meaning immunity from milk.
Precisely. It's the passive immunity the piglet receives from the sow, first via colostrum and then continuously via her milk. The key player here is a specific type of antibody called secretory immunoglobulin A, or SIGI. There's this fascinating process called the gut-mammary SIGI axis. When a sow is exposed to a gut pathogen, like rotavirus, specialized immune cells in her gut get activated. Some of these cells then actually migrate to her mammary gland.
They travel from the gut to the udder.
Yeah, it's pretty amazing. Once in the mammary gland, these cells produce large amounts of pathogen-specific SIGI, which is then secreted directly into her milk. So when the piglet nurses, this SIGI continuously bathes its intestinal lining, acting locally right there in the gut to neutralize virus particles before they can cause infection.
So it's immunity in the gut, not in the bloodstream.
That's a critical distinction. This is local mucosal immunity. Circulating antibodies in the piglet's blood, like serum IgG, aren't very effective at protecting the gut surface. It's all about that continuous supply of SIGA in the milk. Therefore, almost all successful prevention strategies aim to boost the amount and specificity of that SIGA in the sow's milk.
Okay, so how do you boost it? Vaccination?
Vaccination of the pregnant sows and gilts is the primary method. There are commercial vaccines available. Typically, you give them to the females in late gestation, timing it so that antibody levels in the colostrum and milk are high when the piglets are born. However, and this is a major however.
Here comes the catch.
Right. The significant limitation is that these commercial vaccines, almost without exception, contain only rotavirus A antigens, usually specific common strains like G4 or G5 serotypes.
But you said there are other species, like B and C.
Exactly. And remember, there's no cross-protection between species. So even if a herd is perfectly vaccinated against RVA, the sows will produce great SIGA against RVA, but the piglets remain completely vulnerable to infection with rotavirus B or rotavirus C.
Ah, so that explains why you can still have outbreaks even in vaccinated herds.
Precisely. It's a major reason why clinical rotaviral diarrhea often persists despite good RVA vaccination programs. The vaccines are targeting only part of the problem.
So if the commercial vaccines have this gap, targeting only RVA, what else can producers do? I think I've heard people talk about something called feedback. Is that related to trying to cover those other species?
Yes, exactly. To try and bridge that immunity gap left by RVA-only vaccines, many producers turn to a practice known as feedback, or sometimes controlled exposure. What this involves is intentionally exposing pregnant sows and gilts, again usually in late gestation, to fecal material collected from diarrheic piglets on their own farm.
So feeding poop back to the sows.
Essentially, yes, after dilution and preparation. The rationale is to expose the sow's immune systems to the specific rotavirus strains, including potentially RVA, RVB, and RVC, that are actually circulating and causing problems on that specific farm. If done correctly, the idea is that this stimulates the sow to produce targeted SIGA against those exact strains, providing homologous farm-specific protection to her piglets via the milk. And in theory, it can be effective for stimulating immunity against those non-RVA species that the vaccines miss.
Okay, I can see the logic. But feeding manure back sounds, well, risky.
Extremely risky, and that's the huge downside. The fecal material used in feedback is essentially an undefined, uncontrolled inoculum. It's a raw mix that could contain not just the target rotaviruses, but also a whole cocktail of other dangerous pathogens, potentially PED virus, PRS virus, virulent strains of E. coli or Clostridium, Salmonella, you name it.
Oh, wow. So you could accidentally introduce or amplify other diseases?
Absolutely. You risk causing new outbreaks or making existing problems worse. It's a major biosecurity hazard. Because of these significant risks, feedback is often discouraged, regulated, or even outright illegal in some countries or regions. This creates what some people call the vaccination biosecurity paradox. Producers are stuck between using commercial vaccines that offer incomplete protection, RVA only, and resorting to the high-risk practice of feedback to try and get broader, farm-specific immunity. It's a real dilemma.
That is a tough spot. So it sounds like immunity is crucial but complicated. What about just trying to keep the virus away or keeping the levels low? Biosecurity.
Yes, biosecurity and environmental management are absolutely co-equal, essential pillars of control right alongside immunity. You can't rely on immunity alone. The goals here are really twofold. First, bioexclusion, trying to prevent new strains of rotavirus or other pathogens from getting onto the farm in the first place. And second, biomanagement, focusing on reducing the amount of virus already on the farm. Because even pigs with good passive immunity can get sick if they're exposed to an overwhelmingly high dose of the virus. The immune system can be swamped.
Okay, so keeping things clean is vital, but you said this virus is really tough.
It is incredibly hardy, which means standard cleaning and disinfection protocols have to be rigorous and done correctly. The absolute critical first step before any disinfectant touches the surface is thorough physical cleaning. You have to remove all visible organic matter, manure, bedding, feed residue. Disinfectants don't work well if they have to penetrate dirt.
So elbow grease first.
Lots of it. High-pressure washing, preferably with hot water and detergents, is usually needed to really clean surfaces in farrowing crates or nursery pens. Then, once clean, you apply an effective disinfectant. Given rotavirus's resilience, you need to choose products known to work against non-enveloped viruses. Things like phenols, peroxygen compounds like Virkon S, glutaraldehyde, or some chlorine-based products can be effective if used at the right concentration and contact time. Iodophores, interestingly, are generally not considered very effective against rotavirus.
Good to know. Any other steps after disinfecting?
Drying. This is a crucial final step that often gets overlooked. Allowing surfaces to dry completely is very important. Desiccation drying out helps inactivate many pathogens, including rotavirus, so adequate downtime between batches of pigs to allow for thorough cleaning, disinfection, and drying is vital. This really highlights the importance of strategic production flow. All in all out, AIAO management by room or barn is fundamental.
Meaning empty the whole room, clean it, then refill it.
Exactly. Move all the pigs out of a farrowing room or nursery, then do that meticulous cleaning, disinfection, and drying, and only then bring the next group of pigs in. This breaks the cycle of transmission. Continuous flow systems, where there are always pigs of different ages in the same airspace, make this level of sanitation almost impossible.
Right.
And finally, you have to manage all the other ways pathogens can move around. Fomites, things like boots, equipment, carts need regular cleaning and disinfection. Strict protocols for personnel are essential. Dedicated boots and coveralls for specific barns or areas, strict hand-washing rules, maybe protocols for working with younger, more susceptible pigs before moving to older pigs. And don't forget, integrated pest control rodents, flies, even birds can potentially spread viruses mechanically. It all ties together.
Wow. So we started with what sounds like a simple farm problem, piglet diarrhea. And we've really uncovered this incredibly complex, multi-layered battle against, well, an invisible enemy. It's crystal clear there's no single silver bullet, is there? Controlling an endemic virus like porcine rotavirus, especially with multiple species involved, demands this integrated, multi-pronged attack. You need to optimize maternal immunity, minimize how much virus the piglets encounter, and make absolutely sure that passive immunity actually gets from the sow to the piglet effectively. It really is a constant dance.
It truly is. And maybe if we connect this back to the bigger picture, thinking about pigs as these potential mixing vessels for rotavirus evolution and the constant emergence of new strains, it really underscores these broader questions about how pathogens move between species. It highlights this continuous dynamic race between pathogens constantly evolving and us constantly trying to develop and adapt our control strategies. It's a challenge that extends way beyond just the pig farm, really touching on global health issues.
A race that never seems to end, and certainly makes you think differently about those seemingly simple problems. Something definitely worth exploring further.